Hello, everyone. Good morning. For those of you who don't know me, my name is Angela. I'm a student at the University of Minnesota, and I am one of your NPHC hosts. Today, I have the pleasure of introducing the Minnesota Ovarian Cancer Alliance. The Minnesota Ovarian Cancer Alliance is a statewide nonprofit organization dedicated to funding ovarian cancer research, providing support to women and families, educating the medical community, and raising awareness. MOCA has a program specifically dedicated to educating the healthcare community about the signs and symptoms of ovarian cancer so that women can be diagnosed early when the disease is most treatable. Today, I have three lovely survivors who will be joining us to tell us their story. But first, I would like to give the floor to Ms. Stephanie Giuliani, the Community Support Program Manager for MOCA. Let's give a warm welcome to Steph.
There we go, unmute. Thank you so much for that introduction. I am so happy to be here with you guys. And like you said, three amazing ovarian cancer survivors that they're gonna share their stories with you. So I'm gonna share my screen before we get started and do just a little brief presentation on ovarian cancer. So like Angela said, we are a statewide nonprofit organization and we work with women all throughout the state and their families. We do a lot of awareness in outreach. We do a lot of things within the medical education programs within Minnesota. And most importantly, we fund ovarian cancer research. So we are one of the top funders in the nation for research. We've given over $9 million to ovarian cancer research, which we are really proud of. And so I will share a little bit about ovarian cancer, and then I will hand it over to really the most impactful part of this presentation, which is hearing from three survivors themselves. And then I know we'll have time at the end if you have questions for any of those. So just a little bit kind of about the facts of ovarian cancer. Ovarian cancer is the 11th most common cancer in women, but really the big thing that sticks out, it is the deadliest of all gynecologic cancers. It affects women of all ages. The average age is 63, but we have a young survivor network at MOCA. We know that it affects women of all ages. It's not a postmenopausal disease. So there are risk factors when it comes to ovarian cancer. There are some things that can put you at increased risk and some things that can decrease your risk. So some things that put you at an increased risk for ovarian cancer is a personal or family history of breast, ovarian, uterine, colon cancers. Certain genetic mutations, the ones that are the kind of the most common is the BRCA1 and 2 genetic mutation. But there is a wide panel of genes that every woman with ovarian cancer should get tested for. Hormone replacement, more menstrual cycles, increased age. Some things that can decrease your risk is removing your ovaries or fallopian tubes. The new research shows that ovarian cancer actually likely starts in your fallopian tubes. Giving birth, breastfeeding, taking birth control, and tying your tubes. So early detection is critical, but very difficult. A pap smear does not pick up ovarian cancer. There is not an effective screening test. And so that is really our biggest, mission to fund research. And we do fund nationally for early detection specific for that reason. 90% of women do go in and actually report symptoms when they're early stage, but only about 15% are diagnosed early. The average stage for ovarian cancer is 3C, which of course is harder to treat. And so we really need an early detection test. So some of the main symptoms, these are the main 4 symptoms of ovarian cancer: bloating, pelvic or abdominal pain, difficulty eating or feeling full quickly, and then urinary symptoms, either having the frequency to go or the urgency. So these are the 4 main symptoms, which are very vague. Men and women have these symptoms. And so we really say, if you have any of these symptoms, if they get worse over a couple weeks, go see your doctor. And so when ovarian cancer is suspected, these are the following that should be performed: a pelvic and rectal exam, a transvaginal or pelvic ultrasound, and then there is a CA125 blood test. The normal range is 0 to 35. Unfortunately, some women are diagnosed in that normal range, so it's not necessarily an effective tool for everyone. And then very, very important, refer to a gynecologic oncologist. They specialize in ovarian cancer, and there are many studies that show if you are seen by a gynecologic oncologist, you are going to live longer. here. We work with many in Minnesota. I know there are people from all over, the world right now listening, but we have an advisory committee with MOCA. So happy to share that with you if you want to go to our website. So last, again, I know there's people from everywhere, but if you are in Minnesota, we'd love to have you get involved and yeah, be involved with MOCA. We're a great organization. We do Ovarian Cancer Awareness Month is September, so we are looking forward to that. So I will now hand it over. So I have 3 speakers that I would love to introduce. If you guys all want to share your cameras and put yourself off mute. Good, Catherine, Lori, and I know Nancy. Wonderful. I just want to say thank you so much for being here. This is really the highlight of this presentation, is hearing from survivors. So I think we will hand it. I don't know if anyone prefers to go first. Why don't Nancy, do you want to go first? And then we'll hand it off to the rest. And Lori, if you want to put yourself on mute, and I will do the same while while Nancy speaks. Nancy, thank you for being with us.
Well, thank you. And nice to see you too, Angela. It's been a while. My name is Nancy Adsum, and I'm a almost 22-year survivor. And probably next week I get the number 22, and those are really significant when you're a cancer survivor, is to know you just don't forget. So it was actually in 1999, and I was at that time 49 years old, and I was diagnosed with a stage 1C. So we caught mine really early, and I've had no recurrence since that time. So what I kind of like to say in these sessions is nobody wants an ovarian cancer story. Nobody wants a cancer story to begin with. But if you have to have one, I guess you'd pick mine because it was caught early. So in the spring of that year, I was having severe stomach pain and cramping, which is one of the 4 symptoms, which seemed in my mind to be connected to my menstrual cycle, because we all try to self-diagnose to some degree what's going on. And I decided to see a gynecologist, because at that point I hadn't been seeing one. I'd just only been seeing an internist for my annual checkups because I'd been perfectly healthy. I assumed it had something related to menopause, since I must be at that age, whatever that age is. And during that first visit with this new gynecologist, I reported symptoms of intermittent constipation, and I couldn't relate to my cycles, pain during intercourse, and frequent urination. And of course, the frequent urination is another one of the symptoms. So I had 2 of the 4. And actually, when I put this presentation together a few years ago, it had been a long time since my cancer. So I actually pulled my medical records out of the system, so that a lot of these words were right from the doctor's notes that I'm speaking this morning about this stuff. So I've really been, as I said, very healthy up to this point. I'd had a tonsillectomy at age 6, 2 vaginal deliveries at age 27 and 35, which should have been a positive risk factor, and a removal of a Gardner duct cyst. So I've been very healthy. So during this first visit, the gynecologist in this order did a pap smear, performed an endometrial biopsy of my uterus, and then did a pelvic exam. So I left the appointment confused and with many questions. I wasn't sure how to handle this confusion in my now health history. Well, a week later, the results of that endometrial biopsy came back, and they called me and said it was showing complex hyperplasia. And I was treated with Provera, a progesterone, for 2 months, and they told me then to come back and they would do another endometrial biopsy. I did as I was told. I've always been a really good patient, but I still had many questions as we went along. So I took it for 2 months, and then I made my appointment to go back, and the severe cramping was still there and actually seemed to be worse with bowel movements and when my bladder was full. Again, notes right from my doctor's notes. I also complained of this second appointment of a lump that appeared just above my pubic bone in my lower abdomen. And I remember telling the gynecologist on this second appointment that I thought we should do another pelvic exam. And his initial reaction was, no, we just did one 2 months ago. And I'm sure he was thinking insurance won't cover it. But he finally did agree, and the pelvic exam revealed a very large 8+ centimeter cystic feeling mass that was quite tender and reproduced my symptoms fairly dramatically. Again, right from my doctor's notes. So at this point, he ordered a pelvic ultrasound and a CA-125, which, as Stephanie already went over, would have been two of the very appropriate things to do. I was just starting to learn that I needed to be proactive and be the leader of my healthcare team. Well, the ultrasound showed that the mass was actually 16 centimeters and needed to be removed, and that CA-125 was above normal. So again, normal is up to 35. I think I was 85, so it didn't seem like it was that much higher in relative to other people. But again, it's not. It can only be used as an additional piece of data. Well, the gynecologist met with me then and discussed what my options were. Now, again, this was 22 years ago, and he told me that he could do the surgery and remove the mass, or he could refer me to a gynecologic oncologist. Now, that wouldn't happen today. Because of people like us speaking out, all these doctors would definitely refer me to a gynecologic oncologist at that point. But at that point in time, I had an option, and luckily I chose the gynecologic oncologist. My surgery was performed 3 days later. And before the surgery, I remember asking the surgeon how long it was going to take to do this surgery. And she told me, I can't remember what the exact time frame was, but she says, you know, if I don't have to do that staging, it will be this long of time. But if we think it's malignant and we do the staging, then it's going to be this amount of time. So guess what? The first thing I asked the nurse in the recovery room was, what time is it? And her answer told me that they had to stage, it must be cancer. So that's actually how I found out that I was a cancer person. Well, following that hysterectomy and the appendectomy, I began the chemo. And at that point in time, there were two differing medical opinions on how many courses of chemo I actually needed. The gynecologist that was going to be administering the chemo felt that 6 courses were the norm, and that's what I should do. But I remembered that the gynecologic oncologist that did the surgery had told me about recent studies indicating that because I was a stage 1C, that my condition only called for 3 rounds, that I could cut my amount of chemicals in half. But it was my decision. Again, another point in recognizing that I was the lead in my healthcare. My husband and I had serious interviews with both of these doctors, and then I made the decision to go with 3 rounds. Well, all this medical talk, I still had a family to tend to, and I had friends that were concerned about me and a future that I hoped would stretch out. And because it's been so many years, I think I've blocked a lot of memories that weren't pleasant. I don't remember fear. I do remember that I couldn't say that C word for a few weeks. And at that time, I felt like I had little control over my life. You get diagnosed, and then you have to be here at this time for lab work and over here for imaging the next day. And there's always something on your calendar eating up what you perceive as your precious lifetime. But what I remember is that what I ate made a difference in how I felt. And I could control that. A lot of things I couldn't control, but I could control what I ate. So I remember I recorded all my meals in a journal. And I remember if I ate protein for breakfast, I was going to feel better. And if I had a box of raisins in my purse when I took my 13-year-old daughter to basketball this afternoon, I might need it, better have it on hand. I could control that. So for the first few years, I continued these follow-up visits with my gynecologic oncologist and gradually brought back my regular gynecologist into the visit schedule. Again, understanding that I was in control of who was my provider and at what point was I going to bring him back, and if I was going to bring him back, or was I going to change? And then that evolved into, after 5 years, my oncologist cut me loose. And that was in 2004. I remember her giving me a pin. It had a teal, it was teal because that's the color of ovarian cancer, just as Stephanie's shirt is indicating for us today. But I remember she gave me the pin, and then as I was leaving, her parting words to me were regarding DNA and genetic testing, and my daughter and my son and my sisters, but I wasn't listening. I just wanted to move on. 5 years, with no disease. She told me I didn't have any more chance of getting cancer than the person walking outside on the sidewalk, outside the window at that point in time. It was only many years later, after listening to many of these fine MOCA speakers that I participate with, that I paid attention and went in for genetic counseling and then the testing. And I was happy to find out that I was negative for BRCA, and my kids, as well as my extended family, were grateful that I did complete that assessment. It also showed me how important family medical history is. We do a lot of family history with all these, just send in a drop of blood and they can tell you all about your family background, but family medical background is just as important. And because I did the testing then, I could tell my family to add to their family medical history that Nancy, their sister, daughter, was diagnosed with ovarian cancer at the age of 49. That's all they needed, but they might need that someday. Well, I was really grateful that I requested a second pelvic exam and that the OBGYN changed his mind and agreed to do it. I could feel that mass, and I knew my body, and it was, I think, the key turning point in my early diagnosis. In discussing with him later, he did say he would change the order of the exam to better feel that mass in my stomach earlier. The early diagnosis caught it at a 1C, and it allows me to reduce my chemo dramatically. So I know there aren't any guarantees going forward, but I've had almost 22 years extra, I think, to spend with my family and with my community, and to help in this message to our medical people, to other survivors, to caregivers, how important it is that this community rally together. There's one piece that popped up afterwards. There's always the chance for complications down the road. And though it was never described to me or even mentioned as a possibility, I developed lymphedema 14 years after my surgery, which means that all the lymph nodes that were removed from my body to stage the cancer, my body was missing them. So my right leg swells up. It's constantly swollen. I have to wear compression 23 hours out of the day. And I have very specific routines I have to go through to keep it under control, but it's chronic and it's progressive. And, but I'm alive today. But there's always little giddy up hitches along the way. So just another thing for me to be proactive about. So thanks, Stephanie. Thanks, Angela.
Thank you so much, Nancy, for sharing your story. We greatly appreciate it. Lori, do you want to share yours next? And then Catherine can go last. Perfect. Thanks, Lori.
Sure. First of all, I want to congratulate and thank you, students, for choosing healthcare as a profession. We need you. We need good healthcare providers. I've been a nurse for 45 years, and it's not an easy road to take, healthcare, but thank you for choosing it. I could be the poster child for a saying that goes, ovarian cancer whispers, so you must listen carefully. And that means the patient and the providers. There's a reason that 90% of women say that they had symptoms early on, and only 15% of them get caught early. We need to make people, healthcare providers, more aware. And the funding that MOCA gives to research is very important, because we really need a test that we can give women. We don't have one now. So my journey started when I was, like Nancy, 49 years old, which is considered a young age, actually, for ovarian cancer. And in July of that year, I started having changes, bloating, constipation. I just didn't feel right. I just knew something was wrong with my body. I went in, and it was get more exercise, eat more fiber, take Miralax. Okay. It didn't go away. It got worse. And now I was getting up at night, needing to urinate, because somehow it just felt like my bladder didn't have the capacity it used to have. So in September of that year, I went in again, constipation, bloating, and now urinary frequency and urgency. Well, you're 49 years old, you know you're going to start seeing some changes in your body. Get exercise, eat fiber, take Miralax. In December of that year, I noticed when I put my black pants on to go to a Christmas party that I've always fit, and I hadn't gained weight, there was 3 inches between the ends, which was just seemed strange to me. And I just was feeling more and more. Now I had the sensation that if I ate, I couldn't take any more. I just got full really fast. Well, we'll make an appointment for you. The appointment was in mid-January. By this time I had turned 50. When I went in mid-January, the provider that I saw said, "Lori, are you pregnant?" And immediately did a pregnancy test on me. Also, this time did some more extensive testing with the CA-125 and an ultrasound, and saw a mass about the size of a cantaloupe. And no wonder I couldn't get my pants together. That was on a Friday, and I was in surgery on Tuesday. But like Nancy, I went under anesthesia not knowing, because ovarian cysts are common and they can get really big. So, but I said I didn't want a biopsy because I knew it needed to get out of there. It was causing so many problems. So I went into surgery not knowing either. I did not have a gynecological oncologist available to me in my community. I could have gone down to Mayo, but it was more important to me at that point to stay where my family was, so my family didn't have to make this 5-hour trip. But my oncologist was affiliated with Mayo and was using the Mayo protocol. So I felt safe. Looking back, I should have gone to Mayo, but I didn't. So they did the surgery. It took about 4.5 hours. a GYN surgeon did the surgery, an oncology surgeon did the staging. When I did wake up, the first thing I asked, of course, was, what was it? And I was told that, yes, in fact, it was ovarian cancer. And also upon the pathology report, found out it was also uterine cancer, a different cancer. They were just happening at the same time. So after about 3 weeks of recovery after surgery, I did go through 6 chemotherapy treatments. And that was the most scary thing for me. In hindsight, I look back, and I was a nursing instructor at the time. I had been a nurse at that time for like 30 years, and I had never taken care of one patient with ovarian cancer that lived. And that was my base. That was my frame of reference. So I was pretty scared. But I went through the chemo, and I was extremely afraid of the chemo. That strong stuff, it's really kind of, in a way, it's strong chemicals, it's poison. And to just watch that go in your body, it's hopefully killing the cancer cells, but you also know it's killing a lot of other things. Of course, you lose your hair, and I ended up and still have peripheral neuropathy because of the nerve damage that it did. But it was a very scary time. And it kind of hits home that this is a journey. It's not just from diagnosis to the end of surgery. Then you're going to have chemotherapy, and you have to have support and good healthcare providers during that. And even afterwards, I have had issues that had been caused from chemotherapy, and it's been 16 years now, or 17. And so I still have those issues. One thing, a story I always like to tell, especially to healthcare students, is that when I was working, I was a nursing instructor, and one of my students had finished her program and needed to take her state exams, and she didn't have the money. And she was going to be a really good nurse. And I said, here's the money, take your exams. You need to get out there and start working. And she said, oh, well, I can pay you back the first paycheck I get. I said, nope, your payback to me will be the best nurse you can be. Well, that had happened probably 15 years prior to my diagnosis. And I remember sitting in this big chair. It's kind of like a dentist chair when they give you chemo, being scared to death that first time. And I was told that the oncology nurse would come in, and she would start my treatments, start the IV, and get the meds running for the treatments. I was almost paralyzed with fear. I was more afraid then than I was even prior to surgery. And when the door opened and the nurse walked in, it was that girl. And so remember, everything goes into a circle. And as a healthcare provider, it'll come back to you tenfold. So good luck in your profession. And remember to listen closely to your patients. We all know when something's wrong with our bodies. And so listen, because ovarian cancer whispers, and you have to listen carefully. Thank you.
Oh, Lori, thank you. That story gets me every single time, as many times as I've heard it. So thank you for sharing. And now I will hand it over to Catherine, and then we'll open it up for a Q&A. Thanks, Catherine.
No, thanks, Steph. Hi, everyone. My name's Catherine, and I was not 49 when I got diagnosed with ovarian cancer. I was 24. So I just passed, in May, I passed my 6-year mark. So not as many years so far, but I'm pretty happy. 6 is pretty good for me. So my experience prior to my diagnosis is really similar to Lori's and Nancy's. In cancer that Stephanie mentioned, I was kind of sick to my stomach. I didn't really have an appetite. I was bloating a lot, but this was in conjunction with a breakup that I had. So I'm married now, so I can confidently say that this was the only time in my life I was ever broken up with. So, so it was really bad for me. I had never, like I said, I've never been dumped. So I was really depressed. I was drinking a lot, eating a lot of junk food. So when I had these symptoms, I wasn't really that surprised. I was like, okay, I'll just try to take better care of myself. The other thing that I had at this time, I had a really bad cough, but again, you know, I was kind of preoccupied and I didn't really care. So this was in November of 2014. So my family was going to go to Mexico for Christmas that year. And right before we were leaving for that trip, I felt like I had a urinary tract infection. So I went to a walk-in clinic. You know, I'd had a UTI before, so I just wanted to get it out of the way. You know, go to the doctor, get antibiotics, and go on my trip. So the doctor put me on a 10-day course of antibiotics, and I went on my way to Mexico, and I had a terrible time. I was still super bloated. I was still, you know, sick to my stomach. I couldn't go to the bathroom. I was actually so bloated that I had stretch marks. So like, I didn't want to do any of the activities my family was doing. And so while I was sitting inside by myself, my entire family was, you know, whispering to each other, wondering if I was pregnant. So that was really fun for me. We got home and my mom was, you know, we'd been together for like 8 days and she's like, you need to go to a doctor. You look and seem just terrible. And I agreed. You know, I had these terrible stretch marks. I was humiliated. I was super tired and I could barely go to work, much less do any work. So I went to urgent care because I had the doctor that worked at that urgent care clinic was a family friend of ours. So I wanted to go to someone that I trusted. And his first thought was that I was pregnant, like my family all thought. And, you know, knowing my recent history, I knew that I was not pregnant, but I did a urine test anyway, and it actually did come back positive. And I was like, no, that's actually impossible. So what is going on here? And he's like, I don't know. So he sent me to get an ultrasound, and they did confirm that I wasn't pregnant, but that I did have what they called something in there. That was the exact words they used. I was like, great. So obviously this was expanding outside of the urgent care setting. So I went to my primary care hospital the next day and they did a CT scan. So that was a little bit more detailed, obviously, than the ultrasound, and that showed that I did have a mass on my ovary on my right side. So they scheduled me to see an OBGYN. I didn't have an OBGYN. I would just go to, you know, family practice for all my checkups and pap smears and stuff. So this is the first time I'd ever been to an OBGYN. And she kind of said the same thing. I had a mass, but they hadn't, you know, opened me up. They hadn't done any biopsies, so they weren't going to say what it was or what it wasn't. So I had that appointment. She told me that she would send my chart to a gynecologic oncologist. There was only one in the health system where I was getting treated. So she was sending it to her, and they would schedule my surgery to take out my mass for 2 weeks after my current appointment. But if the gynecologic oncologist reviewed my chart and thought I should get my surgery sooner, they would do it the following week instead of 2 weeks from then. They didn't move my surgery up, so I was like, wow, it must just be like an ovarian cyst or something benign. But I did still feel really tired. I was really cold all the time. My skin was super itchy and flaking off. But again, it was December, maybe January at this point. So I was like, it's not that big of a deal. It's just winter. So I was living with my parents then, since I was kind of just so weak in everything. I was living with them so they could take care of me. And I woke up and my legs were just kind of like mottled with purple and red. It was like really gross to look at. And again, my mom dragged me to urgent care. And again, at urgent care, they didn't really know what was going on, but we explained everything that had happened since the last time I had seen him. We assumed it had something to do with my mass, so I got a steroid ointment, and I was going to have my surgery like 4 days after that anyway, so we didn't think much of it. So like I said, the gynecologic oncologist was the only one in the system, so we had to travel for my surgery to where she was based. I had a pre-op appointment with her the day before, and she, during that appointment, said that I had cancer. I'd seen several providers at that point, nurses, doctors, imaging techs, everyone in between. And no one had said cancer. They all were, very kind of wishy-washy about it. So I was really surprised to hear that. No one had said that. They always just said it was a mass. I liked hearing it like that. I liked that she was very straightforward. I was surprised that she could be straightforward. And similarly with Nancy and Lori, they hadn't done anything with the mass. So I don't know how she knew that. I guess just because she had so much experience, she knew. So I personally really liked that she was really direct with me. It was terrifying, but at least I knew what was going on. So during my surgery, they took out my mass, which was 3 pounds. They said it was about the size of a Nerf football. They took off my right ovary, my right fallopian tube, and then a bunch of lymph nodes. And I spent 3 days in the hospital there. While I was in the hospital, I saw a dermatologist about my skin issues that I was having. And they actually realized that the skin issues with the flaking off and the modeling of colors was actually an allergic reaction to the antibiotic that I had taken for the UTI I thought I had. So she actually said, the dermatologist I saw actually said that I was really lucky that I had cancer. Otherwise, if I never saw a doctor, the allergic reaction would have killed me. So I was lucky I had cancer. And then while I was in the hospital, I was there for 3 days. And I was kind of loopy, of course, following surgery, but the main things that I remember were how kind everyone was, every single person at every single level. I had people coming in and out of my room all the time. It was so disgusting what was going on with my skin. It was just pouring off of me. And everyone who came in my room, from, the housekeepers who had to come in and sweep up all my skin off the floor, they were always so kind to me, never, made a face or anything, even though I knew it was gross. That is a memory that I have. My room was disgusting, and they were just so nice about it and really just caring for me. And the other people that really stick out in my memory were the nursing assistants when I was there. So they had to get me up and get me walking around, and I didn't want to. I was in pain, and again, just so kind, so patient. They're students. I work in healthcare now, and so the people that I work with who are nursing assistants, they're nursing students, or and from all ages, all different backgrounds. And they were the ones when I was in the hospital who made the biggest impact. So after I got home, they had, taken my tumor to stage it. I got a call about the staging of my tumor, and they told me it was stage 3C because they had found cancer cells in one of the lymph nodes that they had taken out. I did not like that they told me that over the phone. I understand not wanting to drag me in to tell me this, in a 5-minute conversation, but it was something really serious that talking over the phone about was really uncomfortable. So knowing that I was stage 3C, I did have to do chemotherapy. And since the gynecologic oncologist was in a different city that was 3 hours away from where I lived, they transferred my care to a medical oncologist for the chemotherapy. So I also had a PET scan, and they did find cancer in that lymph node, but it hadn't spread anywhere else in my body. So that was good news. I did also, in between having surgery and starting chemotherapy, I went to reproductive endocrinology. So those are fertility specialists. Like I said, I was 24 then. I didn't have any kids. I didn't know if I want any kids. I still don't have any kids, but I still might want them. But going into chemotherapy, I knew I could lose the option to have kids from the chemo and then already having one of my ovaries taken out. So through reproductive endocrinology, I did fertility treatments and had eggs harvested and frozen, and they're still sitting there. So, but again, really great experience with the reproductive endocrinology. I know that they have a really tough job with a lot of people struggling with fertility. From any walk of life, you know, whether it's just fertility issues or fertility issues related to cancer or whatever it may be, everyone there, again, really patient, explained everything really well, which, you know, I love because I was super confused and scared all the time. So I started chemotherapy in February of 2015. I had 4 rounds of chemo. Each of them were 3 weeks long. So I would have to be actually in the infusion center, hooked up for like 8 hours a day for like 6 of those 6 days every 3 weeks. So it was really long and super boring, and because most of it was just fluids. But again, in the infusion center, a lot of nurses in there, oncology nurses who were patient, kind, just wonderful to work with, always explained things if I had questions. Same thing with the nursing assistants there as well. I think I probably went through more warm blankets in the infusion center than anyone who'd ever been in there, but they didn't care. They just kept bringing them. One thing that really helped me during my treatment was weed. I didn't use it a lot, but I did sometimes when I was feeling really down. You know, I, again, still had no appetite, kind of queasy all the time, a lot of headaches and fevers from the chemo drugs. And the marijuana did really actually help with those symptoms. It was not prescribed to me. Where I lived, it was not legal to be prescribed to me at that time. But even in the last 6 years, that has changed a lot. And I think that is something that if I were in medical practice, that I would definitely consider for chemo patients. So I had my last treatment in 2015, in May of 2015. And since then I've been going to just having checkup appointments, blood draws with either my oncologist, who I love, or his physician assistant, who also is just delightful. I also, since I was 24 when I got cancer, and I have a really strong family history. Every single one of my grandparents has had cancer or died of cancer. My aunt just got diagnosed with multiple myeloma. So with that strong family history and, you know, me being an outlier, getting it so young, I did have genetic testing done, but I actually didn't have any genetic markers found that are known to contribute to ovarian cancer. So I did that right after I finished my treatment 6 years ago, and I have asked since then if I should get retested, but there have been, even though genetic markers are coming up all the time, there haven't been any new ones identified since my last test. So just thinking about my experience, I was really lucky, kind of like what Nancy said. I mean, my staging was higher, but the type of cancer that I had was very easy to treat. So it was, you know, a very straightforward treatment plan. I had a really supportive family and group of friends who helped me through it. The oncology nurses at the cancer center were incredible. Like one of my favorite memories was, you know, you get to ring a bell when you finish your cancer treatment, and all the nurses came out and, you know, applauded when I was ringing the bell. And actually, when I was at the cancer center for my last appointment this summer, just a checkup appointment, someone was ringing a bell and all the nurses were out there cheering them on. And I was just in the waiting room sobbing because it was, you know, brought everything back. But those nurses just made everything easier. Same with the nursing assistants. And, you know, I had every single medical professional that I worked with was incredible. There's only one person who I didn't really like, who was the person who put in my port. So I had a port for my chemo to go into. So I was under sedation. I was awake, but I was sedated. So like I could hear them talking, and like he was just like talking about, which I understand, like what he's doing that weekend and he should go fishing and all this stuff. And then he was like bragging about how my scar would barely show up, which like you can definitely still see it. That's the only person I didn't like. And that was just a tiny outlier. And I want to particularly call out my mom. I talked about my mom a lot in this because she really was a great fighter for me. She made me go get checked out in the first place. She asked a ton of questions. She went with me for every single appointment. But not everyone has someone like that. I mean, if I didn't have her, I wouldn't have asked even 1/3 of the questions that she had asked or even known to ask. So I definitely wouldn't have been a champion for myself. And I would just, like, my parting thought for all of you is just to think, if you have a patient like one of us who, you know, is really scared, kind of shell shocked, they might not be able to be their own advocate. They may not have someone in their life who can be their advocate. So whether you are their nurse or their nursing practitioner or their nursing assistant or their doctor, just be the person that stands up for your patient and know what's right for them.
Thank you, Catherine, so much. I know Angela will be jumping back on to do our Q&A, which we've had a lot of questions come in. So hopefully we can get to them.
Yeah, thank you so much. Wow. Every time I listen to these sessions, I always cry a little bit. And I know I've heard like Nancy and Lori, I've heard your stories multiple times. So every single time I'm like, it's the reason I want to be a gynecological oncologist. So audience members, please remember you can continue to ask questions in the Q&A box. Also, you can raise your hand and actually ask these questions live. So we'll wait for those to come in, but why don't we start? So one of the first questions we got was, are there any emerging screening tools to detect early ovarian cancer?
Yes, and I see another question too about what research is MOCA currently supporting. So I will kind of answer both of those since I know we have a handful of other questions, but we do fund nationally for early detection specific. We actually fund a researcher in Minnesota, Amy Skubitz, who is one of the leading researchers, wanting to detect early detection. And I know she is looking at blood, or taking a sample in a pap smear. So as we know, pap smear does not pick up ovarian cancer, but I know she is looking at ways that if there can be something in that pap smear that picks it up. And so that's the biggest one. I think people all throughout the United States are looking at that pap smear, if we can add something in there, because the CA-125 is not given, the blood test is not given to everyone. It's only if ovarian cancer is suspected. And so we do fund research though on new targeted therapies, new treatments, recurrences. Recurrence is very high for ovarian cancer. So we are looking at new targeted therapies for especially people who are platinum resistant. So they're not, they don't take chemo, if they recur. So there is a whole wide range of people. We will be awarding new awards this fall. So you can find everything also on our website of our past research and different grants that we've given out. So thanks for that question.
Awesome. I have a little bit more of a personal question from Jasmine. She says, I am 3 years in remission and post chemotherapy. It is so inspiring to hear journeys I can relate to. I wish to continue making an impact with my story as you ladies have had with me today. How do you cope with the emotional aspect of being a survivor years down the road?
I will open, if you guys all want to maybe be off mute, I'll just open it up to whoever wants to answer.
I'll take that first question. I myself doing this helps me cope. You're always afraid. Every time you have an ache, pain, something goes wrong, you immediately, because you know how much it does reoccur, you're scared. And so you're constantly scared whenever you are going to the doctor because you think something's wrong with you. But the best way I found to cope was to help others and to get involved with ovarian cancer research, with ovarian cancer education. So that's how I do it.
I would agree with that. And if it was not obvious, also humor. I just, I can't take it too seriously. Otherwise I go into a deep, dark place. So I just try to, think about the things that were the good things about it and try to make a joke out of everything else. Maybe not healthy, but that's what I do. That's why I'm a therapist.
And I would add, take good care of yourself. With diet and exercise, there's lots of research on post-cancer rehab, the positive impact that exercise and diet can do. So pay attention, listen to your body, pay attention. And honestly, the diet and exercise is going to make you feel good. That's a plus.
Absolutely good answers.
Amazing answers. Next question is specifically for Catherine. What is the egg freezing process like? My mom thinks that I'll need to do it to have kids as a doctor down the line.
So one thing I know is it's very expensive. For me, since I was doing it as a result of cancer, I qualified for some grants and stuff for the fertility treatments, which was really lucky. And then I was also really lucky that my parents helped with the rest of the costs, because even with the they're not scholarships, but the money that I got through those programs, it still was thousands and thousands of dollars. But outside of that, I think, if I'm remembering correctly, I was taking the fertility treatments for 2 weeks. It was really regimented. You have to take them at really specific times of day. You kind of have to mix them yourself. And just like they, depict it in media, you're stabbing yourself with the little injection. By that point, I had been taking blood thinners that way, so I was really comfortable doing it, but it was scary at first to be stabbing myself with these little needles. So I was doing those for 2 weeks, and you have to go in, I think every other day or every third day to have an ultrasound to see how your follicles are developing, and get blood draws to see what your hormone levels are. And you're doing that so that they can schedule the egg retrieval at the exact right time when you have the most eggs developed. So it's kind of dramatic, and you're in there every day, and they're when it's time, they're all right, go. We're doing it now, it's time. But I mean, it was super time consuming. Obviously I wasn't doing anything else at this time. I wasn't working or anything, but I can't imagine going through the fertility treatments and working or having kids or anything else, because I was going to the doctor every single day or every other day. I had to make sure I was doing the treatments at the exact right time. And I would have had to drop everything to go in to do the egg retrieval, which is not super invasive. I was up and moving around and fine immediately afterwards. But, after that, it was I'm really glad I did this. And like I said, I haven't used it yet, but I like having the option. So I am really glad that I did it.
Mm-hmm.
Yeah, I will say off of that, Catherine, and I know there's another question about the uterus. Most women with ovarian cancer do have a full debulking hysterectomy. Uterus, ovaries, fallopian tubes, any other, anything else, which is the biggest thing to decrease your risk, beforehand, if you're looking at that. There is also another cancer within ovarian called primary peritoneal. So even if you do have your uterus and your ovaries removed, the primary peritoneal is like the lining over your abdominal. It's much more rare, but it does kind of fall in the category of ovarian cancer. So I'm thankful that you had that opportunity, Catherine. So
yeah, the only reason that they didn't take out everything was because I was so young. They wanted to keep as much as they could just in case. So I'm thankful that they did that.
Yeah. And I know we're cutting it close, Angela will cut us off, but those questions that we don't get to, I will respond to you directly. So I just wanted to mention that because I know we won't get to all of them, but I will respond.
Yeah, speaking of time, we are actually unfortunately done. I know you can answer questions. You can type answers to questions if you'd like to do that. Otherwise, if you feel comfortable putting your email in the chat, audience members can reach out to you. Thank you guys again for sharing your stories and for being brave and amazing.
Thank you for having us, and best of luck to everyone.
Thanks for having us.
Thank you.
Audience members, we will be sending out a short little feedback survey, so please make sure to fill that out really soon and stay tuned for our next session, which will be scientific communication and research and medicine.